Hello, my name is Dan Carpinetti. I'm a licensed professional clinical counselor and a chief operating officer for All Well Behavioral Health Services, and I'm here today to talk to you about depression. Um, what is depression? That is the first question that is to be asked today. And technically, depression is called major depressive disorder in the fifth edition of the Diagnostic and Statistical Manual of Mental Disorders. Depression is characterized by an overwhelming feeling of sadness, isolation, or despair. A person who has depression feels like they've sunk into a deep, dark hole with no way out and no hope for things ever changing, according to the American Psychiatric Association. So what exactly is depression? In order to be diagnosed with clinical depression, one has to have at least 5 of these criteria. And these are the criteria or the symptoms that folks who have depression would demonstrate. The first one is feeling sad or having a depressed mood. The second one is loss of interest or pleasure in activities that they once enjoyed. We call that term anhedonia. The third is changes in appetite, and that includes weight loss or gain that are unrelated to dieting. In other words, you're not trying to gain or lose weight. Trouble sleeping, or on the other side of that, sleeping too much. Loss of energy or increased fatigue is the next one. Increase in purposeless activity, for example, pacing, hand-wringing, activities that really have no intention or purpose to do anything. Or on the other side of that are slow movements, speech, actions that are observable by others that just seems like you're not yourself. You just slowed down. Depression can also be feeling worthless or guilty, and it can be demonstrated by difficulty thinking, concentrating, or making decisions, or, and ultimately at its highest level, thoughts of death or thoughts of suicide. And that can include just thinking about it, having a plan, making attempts to do that, but the thoughts of death and suicide are the last of symptoms. And in order to be diagnosed, as I said, you have to have 5 of those 9 symptoms. So another factor is that the depressed mood must represent a significant change from a person's normal everyday mood. In other words, there must be a change from who you are. If someone just has a sour disposition and continues to act like that, that doesn't necessarily mean they're depressed. In addition, social, occupational, education, or other important functioning must be negatively impacted by the change in mood. So what does that mean? That means that your social interactions, friends, family, activities that you normally would do or be involved with, occupation, that's your job, your work, or education, obviously school, those would need to be impacted by the depression in order for it to be diagnosed. Symptoms must also last at least 2 weeks for the diagnosis to be given. And depression symptoms can vary. They can vary from mild to moderate and up to severe. So those are the symptoms that you see. And most of us at some time or another have 1 or 2 or several of those. And so it's important to understand what depression is not. And depression isn't just an occasional feeling of being lonely or sad, like most of us feel from time to time. Depression is different from 3 things that we all experience. We experience sadness. Something happens in our life, we can be sad about it. Grief, and that is if, for example, we lose a relative or someone moves away, we have this grief or bereavement that we experience, which is normal. But in those situations, they're usually symptomatic of coming and going. You have feelings of depression, and then you kind of go back to your functioning. With clinical depression, when you were clinically depressed, that puts you in that hole and you stay there, for, as we said, for at least a 2-week period. There are also medical conditions, such as thyroid problems, brain tumors, vitamin deficiencies, and some of their symptoms can mimic those of depression. So you need to be careful that you rule out those things before you are diagnosed as being clinically depressed. Some drugs and medications can cause symptoms that appear to be depression also. So using some drugs and medications could be a factor, and it might not be depression, it might be influenced by those drugs and medications. In addition, there are some other forms of depression that are not clinical depression, or what we call major depressive disorder, but there's nonetheless, there are symptoms that and conditions that affect us. And some of these, just for example, are peripartum depression. It was previously called postpartum depression after a woman would give birth to a baby. Seasonal depression, which is also called seasonal affective disorder, shortening of days, being locked up inside because of the weather, whatever that might be, the sunlight periods getting shorter affect people. Persistent depressive disorder, which is also previously was called dysthymia, which is a long-term, low-grade depression. It does not take us into the deep hole, but it keeps us feeling sad for long periods of time. Premenstrual dysphoric disorder, disruptive mood dysregulation disorder, and the bipolar disorders all have symptoms or conditions that seem like depression, but are not clinical major depressive disorder. So who gets depression? And according to the statistics from National Institute of Mental Health, 1 in 15 adults in any given year will experience depression. 1 in 6 people will experience depression at some point in their lifetime. Depression can strike at any time, but on average, it first appears during the late teens or the early to mid 20s. So who gets depression? Anyone and everyone can. However, women are more likely to experience depression than men. And some studies show that up to 1/3 of women will experience a major depressive disorder episode at one point or other in their life. So risk factors. Anyone can be affected by depression, even someone who seems to live in good conditions, good situations. There are several factors that we look at here. Biochemistry, that's the difference in brain chemicals. The chemistry of the brain might contribute to the symptoms. Genetics, mental health disorders can run in families, and someone who has a mental health disorder can potentially pass on the tendency to get a depression disorder. Personality, some people have low self-esteem, overwhelmed by stress, generally pessimistic. Those things can contribute and can lead to depression. And then environmental factors such as continuous exposure to violence, neglect, abuse, poverty, and some of those things might make someone a little more susceptible. So how is depression treated? Well, first of all, the good news is depression is among the most treatable of mental disorders. Between 80 and 90% of people with depression eventually respond well to treatment. Almost all patients gain some relief from their symptoms. So what do you need to do? Okay. A health professional should do a thorough diagnostic evaluation. That would include a physical examination to rule out the medical conditions that might cause the symptoms that look like depression. And then after that, have a mental health assessment completed by a qualified mental health professional, and that will help to get the diagnosis and be done on the path to treatment. So there are several ways that it can be treated. Major depressive disorder can be treated. First one we're going to talk about is psychotherapy. Psychotherapy, counseling, talk therapy, whatever you want to call it, is sometimes used for mild to moderate depression, and then even in severe depression, along with other types of treatment. But one form of counseling that's used is what we call cognitive behavioral therapy. Cognitive behavioral therapy deals with your thinking and your behavior. And we like to call the process thinking, feeling, and doing. So what goes into the brain, how you process it with your feelings, and then what comes out with your behavior. Those influence your mental health, and depression can be caused by the way we think, the way we feel, and of course the actions that we do. So cognitive behavioral therapy helps a person recognize distorted thinking, wrong thinking, bad thinking, stinking thinking we call it, and help to help the process get to the point where the behavior that comes out is not depressed. Medication is another way. Antidepressants are a way that depression is treated. Brain chemistry can contribute to mental health and to depressive disorder symptoms. So it's important to see a psychiatrist or to see your family physician in order to discuss or look at the possibility of medications if counseling alone is not successful. There's another form of treatment called electroconvulsive therapy, which we're not going to spend a lot of time talking about today, but that's been used to use electricity to stimulate and to affect the brain and the neurological system in such a way that it helps the decrease depressive symptoms. The last one I want to talk about here about how to treat depression is called self-help and coping. And self-help and coping are the things that you can do before you even get involved with a doctor or a counselor. Self-help and coping include things like getting regular exercise. There are things in our bodies, endorphins, serotonin. There are just certain chemicals and hormones and things in our bodies that we can stimulate or that we can control and manage through regular exercise. Getting enough quality sleep on a regular basis is also another way to combat depression. Making sure that you're getting to bed on time, getting enough sleep, getting good sleep. Eating a healthy diet. This is very, very important. Eating the right foods. Too much sugar, not enough vitamins and minerals and things in our diets will affect us and will cause us to not feel well. And that can contribute to depressive symptoms and lead to depressive diagnosis. And then the last is avoiding alcohol. A lot of people drown their sorrows in alcohol. Alcohol is actually depressant. And so if you are feeling depressed and you're taking something that is a depressant, that will contribute to your depression. So stay away from that. Engaging in positive activities is another thing you should look to do. Involving yourself and being around people who are positive and uplifting to you. Activities and things I know that you might lose interest in, but getting yourself, forcing yourself, rewarding yourself for doing them, doing those kind of things also can help someone come out of depression or not feel as depressed as they would have. So it's important to remember depression is a real illness and that real help is available. With proper diagnosis and treatment, the vast majority of people who have depression feel better and they'll overcome it. If you're experiencing symptoms, first step is to see a physician, rule out a medical disorder, and then a psychiatrist or mental health professional counselor get an assessment and go through that process. Those are some of the things you need to know about depression, some symptoms, some characteristics, and some ways to combat it. For more help and for more information regarding depression, you can contact Allwell Behavioral Health Services, and we cover the 6-county area around Muskingum County here, Coshocton, Muskingum, Guernsey, Noble, Morgan, and Perry. And that 6-county area is served by Allwell Behavioral Health Services. Our number is 740-454-9766. Or the Muskingum Area Mental Health and Recovery Services Board also provides services and supports mental health treatment in that 6-county area. And their number is 454-8557. So thank you for taking this time. I hope that this information is helpful. And again, this has been Dan Carpenetti from Allwell Behavioral Health Services.